How to stay safe when taking pain medication. Good day, my name is Dr. Tarila and this is Boston Local Medical Myths Part 2. So today I want to talk about analgesics. Yes, analgesics. Analgesics are simply pain medications. Medications you take for the purpose of modulating pains. Now, at one point or the other, people do fall ill in the course of your life. You take ill at one point or the other. And virtually all illnesses present at one point or the other as pains or discomfort in the body. Now, pain may be perceived differently. Pain is actually perceived differently by different individuals. The intensity of pain that Mr. A will consider discomforting or severe or terrible may not be considered the same way or perceived the same way by Mr. B. So pain perception varies from individual to individual. However, at some point, we may need some form of pain medication. Now, analgesics are broadly divided into two classes. We have the over-the-counter medications and prescription medications. Now, the over-the-counter medications, they are medications that you can walk into a drugstore and get. In Nigeria here, we have different types of drugstores. We have the pharmacies, we have the patent medicine dealers. So in any of them, you can just walk in and get the over-the-counter medications. While the prescription medications are supposed to be gotten based on prescription, but same thing in Nigeria here. My people, but I know that part, let's forget it. Now, the over-the-counter medications have basically two types. We have the NSAID, the group that is known as NSAID, and the group that is known as the acetaminophen. A very good example of the acetaminophen are the paracetamol or Tylenol, as popularly known. Then the example of the NSAID. NSAID simply means non-steroidal anti-inflammatory drugs. Now, they are usually used for treating mild to moderate pain, and a good example of the NSAID are usually diclofenac, you have aspirin, you have ibuprofen. Now, these two sets of drugs that are known as over-the-counter medication for pain modulation, they have some form of side effects, and I am interested today in discussing the abuse of this drug and what they can do to you. Yes, the common paracetamol can actually cause liver failure. Most people don't know that paracetamol has side effects. And most time when I tell them that yes, paracetamol has side effects, they are like, yes, paracetamol has side effects and it is notorious. It's usually not common, but when it does happen, it can be fatal. So paracetamol can cause liver shutdown, it can cause liver damage, acute liver damage that can lead to you needing a liver transplant, or that may lead to your death, especially if you're in this part of the world. Yes, in this part of the world. Now, the other one, the NSAID, the notorious side effect is NSAID-induced gastropathy, commonly known as stomach ulcers. Yes, NSAID can cause what is called stomach ulcers. And they are, yeah, I brought out this material. This is from the NHS website. I just went there and Googled side effects of NSAID. So I'm going to go out of the field now so that you quickly see it. Here it says that indigestion, including stomach aches, feeling sick, and diarrhea. Then look at this, stomach ulcers. This can cause internal bleeding and anemia. Extra medicine and protect your stomach may be prescribed to help reduce this risk. This is putting it mildly. Yes, it's putting it mildly. Now, this set of drugs, if used indiscriminately, or if you are the type that reacts to them, they can actually perforate your intestine. Yes, they can. Now, the reason why I'm doing this video is because of an index case that I want to discuss, with permission, of course, from the patients, and then what I experienced in the clinic. That's why I brought this. I think it is something that we are not discussing enough, and we have to talk about it. So I have this neighbor, a young lady, a mother with child. She called me one night when I was sleeping in the middle of the night at about 2 a.m. I took the call. She was crying, and I tried to calm her down so I could hear what she was saying. And it turned out that she was in crisis. She was begging me on the phone to come over to her house, that she was having abdominal pain. I ended the call and got there. I actually went to her house that night with my first aid kit. And when I got there, she was rolling on the floor. She was barely able to come and open the door for me. I asked her what was the matter. She said that she's having abdominal pain. She was miserable, throwing up everywhere. So I said, okay, no problem. Have you had this before? She said, yes. Are you an ulcer patient? She said, yes. Are you on any medication? She said, yes. I said, okay, no problem. So we know what is going on. So I gave her some. I resuscitated her and stabilized her. Then I demanded for the drugs that this woman was on. So when she felt calm enough, she went in and brought me this. She went inside and brought me all of this. When I saw them, I opened my mouth. So I said, I cannot be quiet. We have to discuss this. So we are going to go through this now so that we know what is happening. The belief that one pain medication does not work is what is causing all of these things. And these patent medicine dealers are helping to push this narrative, and it has got to stop because people are dying from it. It has to stop. Now, this is Panadol. a brand of acetaminophen. That is what this is. This is paracetamol. She had this, so this is not included. So this was what she was given. Then she was also given this. This is an artemether, a brand of artemether lumefantrine. She was given this. This is ibuprofen, 400 milligram. She was given this too. Another ibuprofen, 400 milligram. And then this diclofenac, 400 milligram. And she was asked to take these drugs up. She was supposed to take two from this, 2 tablets in the morning, 2 tablets in the evening. That's 800 milligram morning, 800 milligram in the evening. She was asked to take one from this, which is 400 milligram in the morning, in combination with this 800 milligram. Remember, these 2 drugs are exactly the same thing. They have the same mechanism of action. So she was given 3 times the dose, the supposed dose for her. Then this too. This is diclofenac. She was asked to take 2 tablets in the morning, 2 tablets in the evening, and each of these tablets is 50 milligrams. So she was supposed to be getting 100 milligram diclofenac and 1,200 milligram ibuprofen. This is approximately 3 to 5 times the dose, depending on who is prescribing it. As a medical doctor, she was given that dose. Now, what is worthy for me to mention it right now, that the normal dose can actually give you the side effects that is stated here. Yes, the normal dose of this drug can give you this side effect. Now, this patient was given approximately 3 to 5 times the dose, because sometimes if the pain is severe, the doctor might decide to increase the dose for you. So that's why I'm saying she was given 3 to 5 times the dose. How is this okay? How is this okay? Nothing about this is okay. If she wasn't close to me that night, she would have suffered all night, and God knows what would have happened to her. These drugs are capable of perforating your intestine. The side effects, one of the notorious side effects, is NSAID-induced gastropathy. It's a form of ulcer that can make you to bleed internally and lose your blood content and probably drown in it. Stop patronizing patent medicine dealers. Just stop it. You are putting your life at risk. Go to a doctor, get a prescription, and take. If it doesn't work, if you don't respond, go back. Or better yet, you get a second opinion. You get a second opinion. I've been in the clinic when they rushed in a woman that this drug killed severally, and one of them was a friend of mine, an elderly friend. She had arthritis, rheumatism, this rheumatoid pain, so she kept on patronizing patent medicine dealer for body release every now and then. And one day they just rushed her to the clinic. She was just passing out her blood content through her mouth. She was vomiting it. There was nothing anybody could do. Before the blood could come from the lab, it was late. Stop patronizing patent medicine dealers. These drugs are hurting you. Get your prescription before you take them. That they say they are over the counter does not mean they don't have side effects. Thanks for watching.